showing you here schematically that the idea is to place the tip of the syringe at the base of the sulcus and let the material free flow into the sulcus, giving you that filler of the space. By having you put a retraction cap on top, the patient bites in, they're able to go ahead and push that into the sulcus. We rinse it away, and then sure enough, we have a dry sulcus. Now you can use Traxodent by itself. If you're a cord user and you want better retraction, you can use it with cord. And as you'll see in a little bit, I'm a laser user, and you can use it with a laser. So it's a very, very versatile product when you're all said and done. Another case, one of my cases here. You see an inflamed tissue. You know, if I bevel this and we're going to get some bleeding, which I did. Both I beveled it and got some bleeding. I placed my Traxodent right on top. I have them bite on the compression cap. 2 to 3 minutes on the cap. That's what it looks like when you take the cap off. It looks dry. You saw the bloody mess a few seconds ago. Now it looks dry. You see that the in the sulcus, Traxodent has been compressed. And now what I'm going to go ahead and do is just rinse that off vigorously. And you would think it's going to bleed again, but the actuality, it doesn't bleed. It's dry. We have a clean sulcus. And when you take your impression, you can see bevels 360 degrees around the margin. And when a lab gets this does not fall into their substandard impressions, because anybody can build a crown to something like this. And the bottom line is, if you're not giving your labs absolutely clear impressions, then you're doing them a disservice, and you're doing your patient a disservice. And I'm not saying that taking an impression is always the easiest thing. But taking a really good impression can be easy if you use the right materials to make it easy.